Okay.
Hmm. So in this topic, we are going to study about introduction. We will cover two topics for the introduction. One is your principles or what we call tenets of Halstead, tenets of Halstead. And the second topic will be types of surgeries, that is classification of surgeries. In these two topics of introduction, one is tenet of Halstead and one is types of surgery. From this topic, 2019, 20 or 2021. In your ICAR PG exam, continuously they have asked every year one MCQ. So first we'll see principle or tenets of Halstead. If we look at the name itself, Halstead, how many principles are there? The first MCQ is number of principles. It's very easy to calculate the number of principles in Halstead. Just simply count the number 1, 2, 3, 4, 5, 6, 7, 8. Number of letters in Halstead are 8. From this 8, from this name itself, you will be knowing that there are 8 principles. There are 8 principles. These 8 principles, again I have simplified from the name Halstead, total 1 to 8. There are 8 principles, and these principles are Jaco, Singh. These are 8 principles. These principles are applicable to our modern day or present day surgery. So these are the principles of modern surgery. In these 8 principles, which is nothing but Jaco, the first principle, that is start with the G. This G means gentle handling of tissues. Gentle handling of tissues. Gentle handling of tissues. Question is, why gentle handling? What will happen if we do rough handling? So what is the meaning of gentle handling of tissue? For example, there is a case of pyometra in bitch. There is pyometra in case of bitch. As we know, in case of pyometra, in case of pyometra, the uterus become, wall of the uterus become fragile. It becomes thin, becomes soft. If you handle this fragile and thin or soft uterus roughly, then what will happen? It will tear. Either the wall of the uterus will tear or the blood supply to the uterus will tear. Then what will be the consequences of this rough handling in case of pyometra will be, suppose this is your abdominal aorta. This is your abdominal aorta in case of your bitch. The bitch having pyometra. Pyometra means The reproductive tract of bitch is V-shaped. That is V-shaped. These are the two: uterine horn, uterine body, and cervix or your vagina. This uterine horn is attached with the ovary, and ovary is itself covered with the ovarian bursa. This side also we have ovaries, and this ovary is attached with the horn, and this ovary is also covered with inner bursa. So if we do the rough handling of this pyometra beach, of this pyometra uterus, this uterus is fragile, it is soft, and the thing is that in case of ovaries, the ovarian artery, this is ovarian artery. This ovarian artery is the direct branch of the abdominal aorta. This is the direct branch of abdominal aorta. If you handle this structure roughly, then it will tear off. And the pressure in abdominal aorta is high. And the branches which are coming directly from the abdominal aorta, they are also having high pressure. So if you handle this tissue not gently, roughly or hardly, then there will be massive bleeding. There will be massive bleeding which may cause death of your bitch. So the first principle of Halsted was saying that gentle handling of the tissues. The example is pyometra. This is the bitch, abdominal aorta, and the arteries which supplying the ovaries, they are the direct branches of the abdominal aorta. The direct branches, this is high pressure system, and these branches coming out of the high pressure system, they are also having high pressure blood. If you handle roughly, then you may tear off the vessels. That may cause that may cause massive bleeding. Animal may die because of bleeding. The second case, this uterus is also soft, fragile. If you handle very roughly, there may be chances that this wall may be tear off. If the uterus wall it tears off, in case of pyometra, this uterus is filled with pus. The whole uterus is filled with pus. What will happen? Pus will come out, and this pus material is the infected material. This pus material will spread into the abdominal cavity. It may cause toxemia, septicemia, or peritonitis, and that may cause the death of the animal. So, if you do not follow the first principle of Halsted, that is gentle handling of the tissue, you may end up with the death of the animal, especially in case of pyometra. So the first principle was gentle handling of your soft tissues or tissue. The second principle is saying aseptic surgery. Aseptic surgery. It says that not only the gentle handling, the area where you are performing the surgery, it should be aseptic. A means absence. A means absent of, septic means your microorganism. That surgery should be aseptic. Aseptic means this is the table where this is your animal. You have tied the animal like this. Suppose you are doing any OHE operation. Then first with the animal you will apply drapes. DRAPE. You apply drapes over the body. This is your surgical field where you are performing your surgery. So aseptic surgery, what we are doing with the animal, we are applying drapes. Second case, at the surgical site here, what we are applying betadine in like this circular manner. scrubbing the area. Third thing, the person which is going to perform surgery, that should be aseptic. How to make this doctor aseptic? First, we start with hair cap, that is head cap. Then we'll start with the mask. Then the whole body is covered with the gown. And what is left? These are legs. So we apply here shoes. So the second principle of Halstead saying that surgery should be aseptic. Animal covered with drapes, betadine in circular fashion, it is aseptic field. Then the person who is performing the surgery, that is your surgeon, it should having cap, head cap, face mask, gown and shoes. And one more thing left is the surgical gloves. So all these things, these things make the surgery aseptic. So surgery should be aseptic. The third principle, first is gentle handling, aseptic surgery, and the third is anatomic dissection. Anatomic dissection means while doing a surgery, you must know all the anatomic structures which encountered in between. Suppose, for example, you are doing TECA surgery in case of dog, that is total ear canal ablation. For example, in case of dog, one second. Having vertical canal and this is horizontal canal and then the middle ear. So cancerous or mass. This vertical canal is filled and this horizontal canal is also filled. Vertical canal, horizontal canal, both are filled with tumorous mass. So the better option to go for TECA. Total ear canal means vertical part as well as horizontal part, removal of both the parts. What is important during this surgery? There are some structures which you should know the anatomy. First is your parotid gland. When you are entering the ear, there is some parotid mass of the tissue which is overlying your vertical canal. So during dissection, you should avoid or try to make an incision with minimum cutting of the parotid gland. First is, if you know the anatomy, you should avoid the parotid gland. Second is the facial nerve. Second is the facial nerve. This facial nerve, the location of the anatomical location of this facial nerve is here, like this. Means at the base of horizontal canal. At the base of the horizontal canal, this facial nerve course is present like this. So if you cut the horizontal canal without knowing the anatomy, you can cut facial nerve. If you cut the facial nerve, because of that facial nerve cutting, all the branches of facial nerve will lead to the paralysis of the face. All the muscle get paralyzed. So this is the example where anatomy is very important. The second example for the anatomy is doing the OHG. When you are performing ovaricectomy, you must know that these ovarian arteries, they are the direct branches of abdominal aorta. So we ligate these arteries during the procedure of OHG. So if you forget to tie, or if you tie these vessels loose, then your suture knot may open, or that may lead to massive bleeding, and that may lead to death of the animal. So these are the anatomical parts which encounter in every surgery. So the first principle was gentle handling, second was aseptic condition, and third is anatomic dissection. Second is CO. C for control. Control of bleeding. Control of bleeding. When you are performing any surgery, there may be some cutaneous bleeding, or by mistake there may be some muscle blood vessel bleeding. So at that particular time we have option, that is artery forceps. We apply artery forceps to control this bleeding. Or second is ligate these vessels. Ligate blood vessels with your suture material. So the fourth principle is to control the bleeding. Immediately we control the bleeding with artery forceps. Then we apply your suture material, ligate the vessel, and remove the artery forceps. Next principle during surgery is your O for obliteration. Obliteration of dead space. Dead space. Why the obliteration is needed? Suppose you have opened the abdomen, you have removed first skin, subcut tissue, muscle, and then peritoneum, and you enter into the abdominal cavity. While closing the abdominal cavity, first we close muscle peritoneum, subcutaneous tissue, and at the end skin. During this closure, if we leave some space, that space in future may accumulate pus, may accumulate blood, or it may accumulate serum. This is called as hematoma. And this accumulation of pus is called abscess. And this serum is called seroma, seroma. So if you leave some space which is called dead space, that dead space may lead to accumulation of pus, blood, or serum. And we know this blood or this serum, these are very nutritious, rich nutrient media for the microorganism like bacteria, and that may enhance the infection further. So obliteration of dead space is very much important to prevent abscess formation, hematoma formation, or to prevent the seroma. Last, SAI. S for suture material. So suture material is a foreign body. Suture is a foreign body. So we should use it as a minimum as possible, because it is a foreign body and it may cause tissue reaction. Suppose this is the skin and we close the skin with this suture material. Normally, we remove the suture material in case of skin 7 to 10 days. If we do not remove, if we don't remove this suture, then what will happen? Along this suture tract, this is the suture tract. What will happen? Epithelialization will occur. Epithelialization will occur, and that may lead to some abscess or scarring. So removal of suture is important to prevent this epithelialization along the suture tract or to prevent the abscess or scarring. So use suture material minimum as possible. Next is A for avoid. Avoid suture tension. Normally, we use suture material in case of wound to oppose these wound edges. If we apply more tension, if we apply more tension on the suture, then it may lead to delay healing. If we apply this suture tightly, that may lead to delay healing. So that suture tension must be minimum so as to oppose the two edges perfectly and it allows the healing. The last is the immobilization. Immobilization means suppose there is surgery of intussusception in case of dog. For intussusception, GSD breed is more predisposed. So if there is a surgery of intussusception where one segment entered into the another segment. After this surgery, we give liquid diet to the animal. So immobilization means giving rest to the GIT or giving rest to the animal. Suppose there is a IM pinning, there is plating surgery. So after this surgery, orthopedic surgery, we give we advise rest to the animal so that this fracture fragment which is immobilized by using some plate or pinning that may remain at its place and it helps in healing, better healing. So immobilization giving rest to the organ like in GIT after intussusception surgery we give liquid diet. So and giving rest to the animal like I am pinning, plating, all this we give rest to the animal. So these were some of the principles. So the Halsted 1 to 8, total 8 principles, that is Jaco, Sai. If we follow these principles, we can reduce the infection rate, also called surgical site infection. We can reduce the infection rate. So these were the Halsted principles. Next topic is types of surgery. From types of surgery in 2019, 20 or 21. 111. Every year they asked one MCQ. So the type of surgery, first we classify based on degree of contamination. Based on degree of contamination means the surgery which you are performing is contaminated or it is clean, it is infected or it is dirty. So based on the degree of contamination, There are four types of surgeries. First is clean surgery. Second is clean contaminated. Next is contaminated. And the last is dirty. So these are the four type of surgery. In ICAR 2019, they have asked the example of clean surgery. In ICAR 2021, this year, they asked example of clean contaminated surgery. So clean surgery, clean contaminated, contaminated or dirty. In some books, dirty surgery is also known as infected surgery. Most of the books given these four names, but in some books they have given dirty surgery, also known as infected surgery. So started with the clean surgery. So all this classification is based on degree of contamination. The first is your clean surgery, ICR 2019. What are the characteristic? What are the characteristic of this clean surgery? Clean surgery should be non-traumatic, elective procedure, non-traumatic elective procedure. There should be no inflammation, no infection, no infection, no entry, no entry to GIT, no entry to respiratory tract, or no entry into urogenital tract, and no break in aseptic techniques. Whatever aseptic techniques you are following, there should not be any break. And in this type of surgery, prophylactic, no prophylactic antibiotic needed. So this surgery we call clean surgery. What is clean surgery? A surgery which is non-traumatic. It is an elective procedure. No inflammation, no infection, no pus, no abscess, no entry into these organs, luminal organs. Exception, exception is there, and that is your elective OHE. I will explain this. No break in aseptic technique, and if there is no infection, no inflammation, no entry into GI tract, there is no spillage of contents, no break in aseptic, so there is no need of prophylactic antibiotic. So in case of clean surgery, if I give you one example that this is called as clean surgery, then the best example is your elective OHE, elective castration. See, in definition, we have said in clean surgery, we do not enter, no entry to GI tract, no entry to urogenital, and no entry to respiratory tract. But in case of elective OHE, we enter into the abdominal cavity, we enter and we remove the uterus. Then this elective OHE is the exception. The reason for this exception is, in case of elective OHE, there is healthy uterus. This is not pyometra case. This is the case where uterus is healthy. We are going to remove healthy uterus. So in case of elective OHE, healthy uterus contain very, very low number of bacteria. Very low number of bacteria. So this is the reason that why elective OHE comes under clean surgery. So there are, at least you remember, four examples of clean surgery: elective OHE and elective castration. And this was the example which were given: exploratory laparotomy. Laparotomy. This was asked in your ICAR 2019. That exploratory laparotomy is an example of clean surgery. In this laparotomy, we gave one incision and we just open the abdomen and search for the any disease process or any abnormality. So this is very clean surgery. And the next example of clean surgery is total hip replacement. Total hip replacement. So these are the four examples: elective OHE, elective castration, exploratory laparotomy, open the abdomen to find the abnormalities, and fourth is your total hip replacement. So in case of clean surgery, we can say that there is low level of contamination, because these surgeries are example of based on contamination. So there is low level of contamination and there is low risk of infection. Low risk of infection in case of clean surgery. So what is clean surgery? A surgery which is elective procedure. There is no infection at the surgery site. There is no inflammation. There is no entry into luminal organs except your elective OHE. So prophylactic antibiotics are not needed. Second is your clean contaminated surgery. The term clean means, if we look at previous our surgery, there clean means no inflammation, clean means no infection, clean means no significant spillage of content or urine. This term lead its name clean. Then what is the meaning of contaminated? Contaminated means there is entry into the GIT, entry into urogenital tract or respiratory tract. Means in this case we have opened the GIT part. In this case we are going to open urogenital. What these are the organs which have lumen. Case of clean contaminated surgery, important point is entry into GIT, urogenital tract, respiratory tract. But the most important word is this: under controlled condition. Under controlled condition. This is the point for the clean contaminated surgery. Under control condition means, for example, ruminectomy. This is an example of clean contaminated surgery. The animal having left flank, here we apply Vanguard ring and we open the rumen. Outside we apply our drapes. Here we apply Vanguard ring and drapes. We try to protect the abdominal cavity from any spillage or infection material. So in case of ruminectomy, we open the rumen and we search for the TH. So there is under controlled condition, means with the application of drapes and this ring, we bring the rumen out and we work on that. So in this case, rumenotomy, no content of rumen is allowed to enter the abdominal cavity. The another example of your clean contaminated is your C-section. In case of cesarean section, this is the body of animal. We give one incision and we bring both the uterine horn outside and we apply the drapes. So in case of C-section, uterus is exteriorized and we prevent the contamination of this uterus content into abdominal cavity. Abdominal cavity. So in this case, we have entered one cavity, that is the uterus, but we are not allowing the content of the uterus to get spilled into the abdominal cavity. So we exteriorize the uterus, we apply drapes on all sided, and we make an incision over the uterus and bring the puppies out. So this is the clean contaminated surgery. Next is contaminated surgery. In case of contaminated surgery, suppose we are doing C-section and somehow all the content get spillage into the abdominal cavity. The same surgery which was clean and contaminated now become contaminated. Why? Because this is the part where uterine horn are out and somehow this uterine horn get ruptured and your drape conditions all are not good and the content will go into the abdominal cavity. Then this clean contaminated C-section becomes contaminated. So in case of this contaminated surgery, what are the characteristics? That there may be inflammation present, but that inflammation is usually without pus, non-purulent. There is entry of content, like you are opening the uterus and uterus content enter into the abdominal cavity. So entry of the content or spillage of the content into your abdominal cavity. In contaminated surgery, there may be some fresh wound which are less than 6 to 8 hours. They are also called contaminated wound. The reason for this kind of surgery is major break in your aseptic technique. Suppose you were doing cesarean section and your aseptic conditions failed, and because of that all the content of uterus, the dead fetus, that placenta, that dead material, they enter into the abdominal cavity. That was because of the major break in your aseptic technique. That may lead to contaminated surgery. So in such cases, prophylactic antibiotic are given so that we can control the infection. So prophylactic antibiotics are needed. The last is your dirty surgery. In some books, they call it infected surgery. In this case, you may find old traumatic wounds which are non-healing wounds more than 6 to 8 hours. They are called infected wounds, which are having fecal material. There may be some fecal contamination or there may be some dead material contamination. In case of dirty surgery, you may find purulent inflammation, accumulation of pus. In this type of surgery, there may be perforation of the GIT or uterus or respiratory tract inside the cavity. The best example for dirty surgery is your pyometra. The best example is pyometra. In case of pyometra, this is the uterus which is filled with the pus. In case of pyometra, uterus is filled with the pus and the walls are fragile. There are chances that this may rupture and all pus may enter into the abdominal cavity. Such type of surgeries are called dirty or infected surgeries. In these cases, antibiotics are must. One more example of dirty surgery is your, for example, intussusception. In case of intussusception, suppose it's a chronic one where the neck pieces enter in case of dog, it is ileocolic, which is more common. So once the time passes, this fragment may become necrotic, or there are some chances that there may be perforation of intestine. If the intestine perforate, then this will come under your dirty surgery. So these were 4 types of surgeries which are classified based on degree of contamination. So if we start with your clean, contaminated, and your dirty. If you want to remember 2 examples for each category, remember elective OHE, exploratory laparotomy. In clean contaminated, remember 2, C-section and your ruminotomy. Okay. And in contaminated, which was the contaminated surgery? Some lacerated wound, lacerations of intestine, or cystotomy with spillage of urine, or C-section and ruminotomy with spillage of the content. The dirty surgery, if you want to remember one example, the best example is your pyometra. And the one more example for dirty surgery is the drainage of abscess, that is pus. So these are the 4 types of surgeries based on the degree of contamination. Elective OHE, elective castration, exploratory laparotomy, low level of contamination, low risk of infection. So antibiotics are not needed. But in these all, antibiotics are needed. In this dirty surgery, therapeutic treatment is also needed. So clean contaminated your C-section, ruminotomy, or them in ICAR they have asked that example was enterectomy. Means you are cutting a piece of the intestine and the content may goes inside. If you are removing these content or these pieces safely under controlled conditions, then this will be your clean contaminated. If there is break in the aseptic surgery, then this surgery will become contaminated. So clean may become contaminated. Like you are doing cystotomy here, but if the cystotomy is done under aseptic condition, then it is clean contaminated. If the same cystotomy, some break in the aseptic conditions, that may lead to spillage of the urine, then it will come under contaminated surgery. Dirty means pyometra or drainage of abscess. So these were asked in your ICAR exam. Then there are some more surgeries like radical surgery. This was asked, radical surgery was asked in your ICAR exam 2019. Radical surgery means removal of root cause. For example, pyometra. If we remove or if we do the OHE, then there will not be any pyometra. So OHE is the radical surgery for the pyometra. So this was asked in 2009. Or another example is removal of tumor. We remove the tumor. This is also kind of radical surgery. The next is 2020 ICR. It was reconstructive surgery. Normally things are constructed by the nature. If nature leave some gap, some defect, then surgeons reconstruct them, and that because of surgeons it is reconstructive. So what comes under your reconstructive surgeries? Suppose this is the palate and this is the gap. So we call it cleft palate. We suture the cleft palate and it is reconstructed. This is an example of reconstructive surgery. So the definition asked was correction of deformities or correction of some malformations. That is your reconstructive surgeries. The second example is your cleft palate and contracted tendon. Some calf, they born with contracted tendons. So we remove the tendons, cut the tendons, they becomes normal. That is the example of your reconstructive surgery. Second is your cosmetic surgery. Tail and ear. For tail we use the term docking and ear cropping. These are the cosmetic surgeries. They improve the appearance of the animal. Means your animal becomes more beautiful. So cosmetic surgery is like removal of the tail and doing some ear croppings, but it comes under your ethical issues. This surgery is illegal. Then there is one more terminology, that is plastic surgery. Plastic surgery is combination of reconstructive plus cosmetic. It is a combination of these two. That is your plastic surgery. Next is elective surgery. Elective surgeries which can be postponed. Means you can do today, tomorrow, or after 10 days. That is elective surgeries. For example, elective OHG, elective castration, and these elective surgeries comes under your clean surgery. These are example of your clean surgery. This elective surgery was asked in your Punjab PSC VO exam 2009 19. Next is conservative surgery. Conservative surgery. This was asked in Kerala PSC 2017 VO exam. Conservative surgery means here we try to conserve a part which is affected, which is diseased. For example, there is one animal having fracture. In case of fracture. So without cutting or going for amputation, we can preserve this leg. Suppose this fracture we can preserve with some epoxy fixation, with some circular ESF or IM pinning or plating. First we try to conserve the part, restore the part. So don't go directly for amputation. This is the aim of the conservative surgery, where we try to conserve the limb of the animal. So next, after conservative, the recent question in Himachal VO 2021, and this was restorative surgery. Restorative surgery. Restorative surgery is also known as general surgery. General surgery. So restorative surgery, it means to restore function of body. Without, this point is important, without replacement. Without replacement. If you start doing replacement with some living, non-living material, then this restorative or general surgery, it will become replacement surgery. Definition of both are same. Restorative, we restore function of body. In replacement, we also. But here we use some external living or non-living material to restore. For example, cornea transplant. For example, heart valves. These are the materials which are replaced. Then there is one more important surgery that was asked in one competitive exam, that is exploratory surgery. This is nothing but a kind of diagnostic surgery. Means we are doing a surgery. The purpose here is the diagnosis. For example, for example, ruminotomy. It will give a confirmatory diagnosis of DH. So ruminotomy is an example of exploratory surgery or diagnostic surgery. So ruminotomy is confirmatory diagnosis of the DH. So this was asked in one exam LDO 2011. Then there are two small terms. That is, one is experimental surgery. Experimental surgery for your PhD or MVSC research. In PhD or MVSCs, we do thesis work and our research work. That is your experimental surgery. We do the surgery for the experiment, for the investigation, for your research purpose. And the last is cryosurgery. Cryosurgery, cryo means surgery where we use liquid nitrogen 196 degree centigrade. This year in ICAR 2021 they have asked electrosurgery. Electrosurgery means the electric current converted into heat, and with the help of this heat we cut the tissue. So this was the question. What is electrosurgery? Current is used to generate heat, and with this heat we cut the tissue. So cryo for liquid nitrogen, electro for current, and the next is your laser surgery. Next is your laser surgery. For example, these days they are doing laser OHE, and the famous name is scalpel free surgery. Means in this case, this is the ventral midline where they put incision like this with the help of laser. So they don't use scalpel blade, they use laser to incise on the linea alba for performing their OHE. And the last is lithotripsy, where high energy sound waves are used. This is the lithotripsy. The summary of this lecture is this: clean surgery, clean contaminated, contaminated or dirty surgery. They have asked examples of clean and clean contaminated in 2019 or 2021. Second is your radical surgery, 2019. Then reconstructive surgery, 2020. Then electrosurgery, 2021. So from this lecture, 1, 2, 3, 4, 5 MCQ covered in your previous ICAR exam.